she's always here talking about Dr. Seshni Mudlia. Dr. Seshni is here with us this morning, and we're about to bring you an update of what the COVID situation is like here in the United Kingdom and, of course, across the entire globe. And I'm sharing it on the HRB Breakfast Facebook page, and, of course, and on the Sunday Best Facebook page as well. And you can find that on my page. Go to Poco Para on Facebook or on Dr. Seshni's page, Seshni Mudlia, and you find us right there. Good morning.
Good morning. Good morning. Good morning, Apoko. How are you today?
I'm very well, thank you. Alive and well.
I see you well rested. You seem like you recovered from the birthday celebrations.
I did say yesterday that I had a lot of work to do, and I did do some work, but generally speaking, I mean, after a while, I just said to myself, sod it, man. And I took a very long rest, and I can promise you, I never stepped out of the house. Well, I went out once to take the bin, and that's it. That's it. I came back in, and I did what I had to do, for work, and then I just chilled out.
Yeah, sometimes you need that bit of rest and just quiet time, downtime. It's so important to have rest. And I think this is what the pandemic has taught us as well. As much as we are so used to, going about in our busy lives, we've also had time to take and just to rest, just to rejuvenate. And I think especially over Easter weekend, a lot of people have been taking care of themselves. So it's obviously been, I think we're in a really good place, I think, in terms of the pandemic. And also looking at yesterday, where there seems to be obviously evidence and research that there's an increase in mental health conditions, and therefore taking care of ourselves and, getting support, surrounding ourselves with people, not being isolated, and also, just having rest is so important.
Yeah. I what? Bringing to mind, because you just mentioned the mental health situation. And yesterday, to be honest with you, after the show, I was actually thinking about it, and I was thinking, the consequence, in terms of mental health and psychological, whatever, and psychiatric, whatever. I was thinking about it, and I was thinking, oh my God, we probably need to talk a bit more about that.
Yeah. So we should maybe arrange next week. And it was World Mental Health Day yesterday, and it's Autism Month. It's Autism Awareness as well. So I think it will be important to talk about these topics, at least we can discuss that.
I think we should do that. I think we should do that sometime next week. So sometime next week, we'll just do the numbers.
Yeah.
And in 5 minutes, and then we just move on and do some mental health stuff. We can connect it to the COVID situation, but
and you know what's really interesting is that obviously COVID is affecting people, but even things that are not COVID related. So there was I think people have been offering prayers, and we'd been offering prayers for Richard Okure. I can't pronounce his name, but a young boy that was missing and now has been found dead. And I mean, that's so sad. And it's not just impacting his family, it's impacting everyone globally. And especially in the UK, because people had been offering prayers, hoping that this young boy who's got sickle cell would have been found alive. And obviously, we don't know what has happened. So, I mean, mental health.
He was found in a pond, wasn't he?
Yes.
His body was found in a pond, it's just sad. I was reading the news this morning, and I was thinking, oh, God, this is terribly, terribly sad.
It is, because, I mean, because as I was saying, we were offering prayers from the day he was missing. I saw it on Susan White's post, Jeff White's wife's post, and then someone on our group chats, the prayer chat, said, offer a prayer, Sukyo Mahikari. And I said, yes, I did offer, because I heard it on the radio news and on yours news. And then, it's just sad. And then to find out that he's passed away, and now I've seen it on so many other people's posts, people talking about how sad it is,
Yeah, and so far the police are saying that this, they cannot explain.
Yeah.
Well, it's an I don't know how to put it, but the reason or the cause of death is unexplained, and I don't know. For him to move all the way from Ladbroke Grove in the west of London,
yeah,
all the way to the east and beyond into Essex to Epping Forest, and to be found in a pond in Epping Forest. It's just beyond me. I don't know what's going on with. I don't know. We don't know if it's mental health. We know that he's got
sickle cell. Yeah, I mean, my main concern was, and I think his mom's was about the sickle cell, because if he didn't have his treatment and he was on the streets, what was going to happen? So obviously we've seen something has happened, so it will be interesting to hear. But obviously, I mean, the reason I was talking about it is it's like waking up to that news, not just COVID related, something else, which has touched other people's lives as well, because it's not just not only impacting his family, it's impacting so many other people.
Absolutely.
So we'll just pray that his soul rests in peace, and that his family, obviously, our condolences to his family, and that his mom, I mean, it was really upsetting to see her plea and, ask for help from the police, and
It's very upsetting. It's upsetting. It's really sad news. Anyway, let's move on with our COVID report. The UK's vaccination program is beginning to break the link between COVID-19 cases and deaths. Scientists tracking the epidemic have said. What does that mean? The vaccination program breaking the link between the cases and deaths. What's the meaning of that?
Yeah. So I think what they're saying is that the study found that the rate of infections has fallen by 2/3 since February, and have begun to level off. So they're attributing this to the rollout of the vaccine. So because before January, when there wasn't that much vaccines being rolled out, because the vaccine started, I think in December, we started with the vaccine rollout. Mid-December, and obviously it continued, but the number of infections were quite high. If you remember, we had about up to 20,000 cases a day, but it seems that obviously what they're saying is that the evidence is saying that 2/3 of the infections, actually it's more than that, have gone down, because we're only seeing a fraction of the cases, and so they're saying that so it's the infection rate has gone down, and obviously the spread of the virus as well. The number of deaths have gone down, and this seems to be linked to the scientists are saying that they can identify that this is as a result of the vaccination.
Well, there's a paragraph and it says that while the decline in cases has stalled, probably because people are beginning to mix more, deaths did not follow the same pattern. I honestly don't see the declining cases stalling.
I'm not sure why that is there. I think because they're saying that there's a possibility that we will always still have some cases. It's possible that we might never as much as we would like 0 cases, 0 deaths, we possibly might still have those cases that will be around, like the common flu. So, for example, that is why they are doing the twice a week testing. So this is one of the reasons why they would want to do that.
I see. Okay. And then this problem with the AstraZeneca situation as well, which now under 30s would be offered an alternative.
So under 30s, will be offered an alternative to AstraZeneca, obviously because of the issues of the clots, the blood clots, and the side effects, which have been reported in 7 people. I'm not sure if there's any more, but so yeah.
But the question is, why only the under 30s? Why can't it be? Why can't anybody else over 30s have the choice? Why
So
can't it be offered?
I know. I mean, and that's quite surprising, because they said the recommendation came after a review by the UK drugs regulator that found by the end of March, 79 people suffered rare blood clots after vaccination, 19 of whom died. So this is from the MHRA, which is a Medicines and Healthcare Products Regulator Agency, and that 79 deaths and 19 deaths, 79 cases and 19 deaths occurred after 20 million doses were first administered. And then the people that died were between the ages of 18 and 79. 3 of them were age under 30. So I think that's probably the reason why they're looking at it, is because there were 3 young people that obviously died from this. Yeah. So I think this is the reason why they are saying that.
Yeah.
They're saying that we should be worried about 1 in a million risk. So no treatment or vaccine is risk-free. And then we know that, any medication that you take,
of course we do, yeah,
will have side effects. Any vaccination will have some adverse and side effects. The key question is whether it does more good than harm. So we always weigh the risk and benefits. So the risk of, obviously having, taking it and having the side effects, and for example, like the blood clots, or the risk of the benefits of being treated and having the vaccine and preventing getting the COVID-19. So they said the risk following vaccination is very small. It's about 1 in a million. I think even though they're saying it's 1 in a million, I would say it's still significant, because if we've had 19 people die, and I think they're comparing it because 19 and they had 20 million that they vaccinated. So they've come to a figure of 1 in a million, which minimizes it. But the fact is, for me, it feels that there's still a risk of it. But using statistics, it's 1 in a million.
Right, I'm going to ask you a double barrier question.
Yeah.
First of all, what are the symptoms of one of this blood clot thing? When it happens to you, what happens to you? To you, well, how do we know that you got blood clot? That's number one. And the second thing is, okay, maybe I should not ask that question yet. So let's answer the first one, please.
Yeah. So I think what the symptoms that they will get from the blood clot is that when someone is detected with a blood clot, they might have symptoms before that. So clotting means that the blood gets thicker. So instead of sort of bleeding, so if you get a cut or bruise, sometimes you might bleed. But when someone has clots, and the blood thickens, it's when and that's why people take aspirin or they have a glass of wine to thin their blood. But what the AstraZeneca vaccine has done is that it thickens the blood, meaning that the blood will get clotted, and that I'm just trying to explain backwards going forwards. So explaining the mechanism and then explaining how the symptoms are caused. So it will actually thicken the blood, so it won't be able to just bleed easily. So actually, if you get cut or if you have a bruise, you'll see that a clot can form depending on how deep it is. So the blood actually thickens, and that is related to the platelets. So platelets are the cells in our red blood cells. So this, the red blood that we see, we've got cells called platelets, and these are the ones that are responsible for clotting, and some other factors. There's clotting factors as well. So with the AstraZeneca, obviously your blood gets clotted and can get thick. So when the blood gets thick, as you can understand, if you think about like a pipe and running water, if the water is thin and loose, the water is able to go freely. But if there's a blockage, then obviously it's going to cause some problems. So it's the same with our blood. So if there's any blockage or any thickening of the blood, it can then affect the blood supply. So it'll affect all the organs in the body. Yeah. So it'll cause a clot, meaning the blood will get thick, and it causes symptoms like it could cause symptoms of a DVT, which is a deep venous thrombosis, or pulmonary embolus. So DVT is usually when the clot goes to the leg and can cause pain and swelling and aches and redness of your leg. And the clot, when it goes to the heart or the brain, can cause a stroke or a heart attack. So because as I explained, is blood gets thick, it gets sluggish, it's not able to flow freely, so it will cause all these symptoms. So obviously a stroke, as you know, if it goes to the brain, so stroke happens when the blood supply is cut off to one of the arteries in the brain. So there's different arteries, and then obviously the same with a heart attack is when obviously there's a clot affecting the heart and you get a heart attack. So these are the different scenarios you can get. So in addition to obviously what I've said about stroke and pain and swelling in the leg, there's also with the pulmonary embolus or clots going to the heart, what can and the lungs, specifically pulmonary embolus, is people will get difficulty in breathing. So they might have chest pain, difficulty in breathing, and also sometimes hyperventilation, so breathing faster because they can't actually breathe properly. So there's different symptoms that you can get.
So for example, if you start feeling you can't breathe properly or you're hyperventilating and all that, you should quickly consult your doctor, because
yes,
it might be a blood clot, especially after you've had the jab.
Yes, exactly. So they say the symptoms that they actually, according to the MHRA, was so in terms of the symptoms which they've actually identified. So it actually caused thrombocytopenia, so related to the thrombocytes or the cells in the body, as I said, in the blood cells. And what happened is, so that's actually the clotting and the causing clots. And deep venous thromboembolism, which is what so they're saying that actually the platelets are not that high in the AstraZeneca, just to go back. So it's to do with the platelets and the thrombocytes in the body, in those blood cells. But just going to the symptoms, which is I think what you actually wanted to know, and then we'll come back to what actually happens. So they say a new onset of a headache, blurred vision, confusion, or seizures. So these obviously will be related more if the clots go to the brain. And then anyone that develops shortness of breath, chest pain, leg swelling, and persistent abdominal pain. So that's other symptoms that can also occur. And that's obviously related to pulmonary embolism and to deep venous thrombosis. And then unusual skin bruising and pinpoint round spots beyond the injection sites. So if obviously you get the vaccination and you see unusual skin bruising, so like sometimes you get like a bluish purplish tinge, if you get bruised. So obviously if it's quite unusual for a reaction in your body, if it's like beyond the normal that you would usually get in terms of the color, like the purple and the pinkish or the reddening around the site, and if you get some pinpoint round spots. So these are the main sort of things you will see. I hope that answers your question. Yeah.
Well, yeah, it has. Maybe I should ask the other question. So when I'm trying to phrase it in such a way that it's not shocking, but I just want to talk about that this issue related to dying or to death.
Yeah.
How does this develop to kill a person, to make a person die from blood clots? Yeah. And can it be sorted? If you get the symptoms, can you? Is there any medication or something to just get you out of that situation?
Yeah, very good question, actually. So, so it's a lot to do with. So the way I described it, as I've just said, is with the as I explained that you get blood clots, and then so if you can imagine a clot then goes to your heart, your lungs, your legs, and also to the brain. So it depends on where the clot forms. So usually what happens, Apoku, is that the clot usually forms in the leg. So that's why we call it a deep venous thrombosis. So,
Okay.
when people go on flights, and if you've had a surgery or if you're pregnant, they say you can't travel after so many months, or you can't travel if you've just been for surgery or you're on certain medications. And that is because when you are in the flight, your body is positioned in a way that it's static and for long hours, and you're not going to be
Yeah.
moving. So what happens is a clot can form in your leg, and that's why they give people like those stockings.
Okay.
Yeah, so the stockings that you can use, so to prevent the clots and swelling and to improve the circulation. So this is what happens with a clot. When a clot forms, I'm just giving you that example to try and illustrate what happens. So why people are scared of a clot is when the vein, the deep venous thrombosis, the clot forms in the vein, and what happens is that clot can actually move. It moves to the rest of the body, and then
Okay.
it can then go to the heart, cause a heart attack. It can go, most commonly it goes to the lungs and cause a pulmonary embolus, meaning a clot in the lung, and that's when a person can have sudden death. So it can be quite
Oh,
serious.
okay.
So I was just trying to illustrate to you, and then obviously if it goes to the brain, it can cause a hemorrhage, or it can cause a stroke. So just going back, so this is the way in which it can cause death is through those things that I've just mentioned, those clinical conditions. So the way in which to prevent it and the treatment, as you said, yes, there is treatment. So once it's identified, and usually when you present with symptoms, as I've explained before about the swelling in the leg and of the pain and the swelling, and also chest pain and headache and blurred vision. If you have any of these symptoms and you're concerned about a clot, you would go to the hospital or to your GP. You'd have some blood tests done, and they would then check your blood, your platelet count, and your thrombocytes. And according to that, and some other tests they do, they check the D dimer, which is some other blood tests, and that's related to the clotting and to the deep venous thrombosis. So when they have to diagnose that there's clots in your body, they'll look at your full blood count. So the blood tests that you've taken, they'll look at all those results. So it's usually taken in a purple tube. And with those results, they will be able, like how you detect sickle cell anemia, you check on those same test results. So it's the same with this. So they will check all those results. They will confirm whether you've got a clot, and then they will start you on treatment like warfarin. So warfarin is thinning the blood. So it's like how you
Okay.
would, if obviously, some people with high blood pressure and risk of developing heart disease and problems, heart attacks, and strokes, they take half a disprin. It's advisable to take half a disprin. Obviously, consult your GP and your medical practitioners, or glass of wine that thins the blood. So the same with warfarin. So warfarin actually thins the blood. It gets the clots down. They'll monitor you very rigorously because they'll have to check that it's not thinning too much, because they need to balance it. And yeah, so it's and they give warfarin or heparin. So there's different medications that they can use and monitoring. So if it's caught in the early stages, it's great. So exactly what I said is, if the symptoms are restricted to the leg and the swelling and pain, then you know that the possibility there's ADVT. So getting tested, getting it identified, and then going on the treatment if necessary, is the right steps forward. So it is preventable. So I think possibly every person that obviously has taken AstraZeneca should be obviously on the lookout. I can imagine how concerning it must be for people, if they've had this, and they've had the vaccine. But as they said, the risk is 1 in 1 million. So it's not very, it's not a high risk. So it
Okay.
is still quite a low risk, but and it's not, I don't think they've been able to identify why those 19 people have died and why 79 people have developed this. So there probably is some other of other concerns. But I think that the main problem that they're concerned about is 3 of those 19 were under the age of 30. And as I said, just to recap, the symptoms that the MHRA is advising is headache, blurred vision, shortness of breath, chest pain, leg swelling, persistent abdominal pain, unusual skin bruising, or pinpoint spots beyond the injection site. They haven't given us how long it's so I think you must be wondering,
I was actually going to ask you that. Yeah.
So I don't think it's possible to say, because it can be anything from 2 days to 14 days that you can develop the symptoms. So what happens is, obviously, if you get the clotting starts, then it starts as a clot in your leg, then it moves up to your lungs, your heart, your brain. So that's what happens. So it's good to identify it early. So I'm glad that you've spoken about it, and I hope it raises more awareness for other people.
Well, thank you very much for that explanation and that education. I think it's I mean, it puts my mind to rest, and and I hope that for that person who's listening as well or watching us on Facebook, your heart is at rest now, because the knowledge is power. Really, now we understand how it works, and the percentages and everything. So it's better for us now. Okay. Dr.
I would say if you haven't developed it like within 2 weeks, I don't think there's a huge concern. The risk is 1 in a million, and I think if you are concerned, just contact your GP, your healthcare practitioner. Thank you for listening, and thank you for asking those questions. And I hope that reassures you, and the person who's asked those questions. And just to say that not everyone develops this, so it's highly unlikely if you've not experienced it, because I think what
I had the jab, and I had the AstraZeneca jab, and I have no problems at all.
Exactly.
And, well, all my friends really who've done it, nobody's complained of anything, except one person who I was speaking to him the other day, and they said he had to go to the hospital because he felt a bit funny and he himself he thought it was the blood clotting and all that, and when they did some tests and all that, and he's in the clear now. He's very, very fine now. So
that's good. That's good to hear, because
Ferdinand. That's the only situation where I got a bit scared. I said, "Oh my God, I hope he's not, his blood is not clotting."
I know.
But he's fine.
I know. Ferdinand is That's good to hear.
Anyway, so
because Ferdinand had the AstraZeneca as well the same day as you. So I'm glad that you both obviously haven't developed any effects of the concerns, but I think it's, as you said, knowledge is power, and it's good to have the understanding. I know we're pressed for time, so I'm going to go to the numbers, the figures. But that was really important to talk about it because it's so topical. Countries are stopping the use of AstraZeneca. They've halted its use in children. Now under 30s are not going to get it. So it is definitely very important. So in terms of the worldometer figures, as of the 8th of April 2021, we have 133,718,495 positive cases globally. Total number of deaths nearing 3 million, which is 2,901,600 cases. And every life matters. Total recovered is 107,839,091.
107 million.
Oh, sorry. I know. I'm like just pressed for time because it's like 2 minutes at the end. 107 million, my apologies, 839,091 positive cases, and those have recovered. So top 5 countries remain the same, with USA number 1 with 31,637,243 positive cases with 572,849 deaths. Brazil number 2 with 13,197,031 positive cases with 341,097 deaths. India is a bit of a concern, I would say. We can probably talk about it tomorrow. So 12,928,574 positive cases with a increase in 2,509 113 cases. And I think I read something about Karnataka and a few places in India and Delhi where the cases are increasing. I'm not sure why. And in terms of, but the vaccine rollout has been impressive. I think they've overtaken a few other countries to become one of the most vaccinated places. So
I have a feeling, I know it's a bit of a concern because the infection rate is kind of rising, but I can almost bet my last dollar that maybe in a few weeks it's going to drop drastically because of the rollout of the vaccine and the way they're vaccinating in India. It's impressive, really impressive.
It will. I think it will. You're right. So we'll obviously be on the lookout for that. So India is number of deaths 166,892 deaths. France number 4 with 4,841,308 positive cases with 97,722 deaths. Russia number 5 with 4,606,162 positive cases with 101,480 deaths, and UK number 6 with 4,367,291 positive cases and number of deaths 126,927 deaths. And South Africa remains still quite low on the list, which is 19 in the world on the Worldometer, with 1,553,609 positive cases, with 53,111 deaths. And Ghana, number 91, with 91,009 positive cases, with 752 deaths. And I know I'm over time, but
no, don't worry, just go on.
Just going to the UK figure in terms of the 24-hour figures. So we've got 45 new deaths, so it's a little higher than yesterday, and so and then 2,763 positive cases. So that's your figures as of today, the 8th of April. And just a quick shout out, happy birthday to Catherine Russell. It's her birthday today. She's all the way in Oxford, and hope she has a wonderful, wonderful birthday and lots of love from all of us. And she's from the Mahi Curry Center. So just wanted to wish her happy birthday.
Thank you very much, Dr. Seshni, once again, as always. And we'll see you tomorrow, hopefully.
Yes, definitely bright and early. And it's good to have you back bright and early as well.
Let's talk about a bit about India tomorrow and what's going on there. So I think I will do my research. I know you always do yours, so then we can share it, because I know there's a lot of interest in India around the UK and around the world as well. And thank you very much once again.
Have a fantastic day. Lots of love to everyone, and let's spread the love and not the virus.
Not the virus, definitely.
Bye. Thank you, Poku.
Dr. Seshni Mudlia.
Thanks so much, everyone, for joining. There was a Hospital Radio Bedford update with me, Seshni, and have a fantastic day. Stay safe wherever you are, and namaste, guys. Bye.